Hey everyone, and welcome. When we think about healthcare, our minds usually jump to doctors, nurses, and hospitals. But what if the biggest challenge to staying healthy isn't the diagnosis, but the actual journey to get that diagnosis? Today, we're diving into how something as simple as a ride is completely transforming healthcare for millions of people.
Just let that sink in for a second. For so many people, this isn't some hypothetical question. It's their reality. Having a working car, affording the gas, being healthy enough to drive for hours, all of these can be the difference between getting care and not. This question really gets to the heart of a huge, often hidden crisis in healthcare.
And that crisis? Well, it really comes into focus when we talk about the rural healthcare gap. For folks living outside of big cities, the sheer distance to a clinic or a hospital isn't just an annoyance. No, it's a direct barrier to their health and well-being.
And we're not just talking about running a few minutes late. We're talking about millions of Americans who have to flat out miss or delay getting medical care every single year, all because they don't have a reliable way to get there. A simple checkup becomes this massive logistical nightmare.
Okay, so what does that logistical nightmare actually look like day to day? Let's break down the specific hurdles that make this healthcare gap so incredibly tough for people in rural areas to overcome.
And here's the thing. These obstacles, they all pile on top of each other. First, you've got the crazy distances, sometimes an hour or more each way. Then, unlike in a city, you can't just hop on a bus or call a rideshare. Those options often don't even exist. And finally, if you're already dealing with a chronic illness or have mobility issues, that long trip can feel, well, pretty much impossible to do on your own.
So when you just can't get to the doctor, what happens then? Well, the consequences are really serious, and they create a domino effect through a person's entire health journey.
Look, this goes way beyond just being an inconvenience. It means appointments get missed, it means health conditions get worse, diagnoses that could have been caught early are delayed. And that often leads to more serious complications, which means more trips to the emergency room for things that could have been managed with simple, routine care. The bottom line is, a lack of transportation directly leads to people getting sicker.
But here's the good news. There's a solution that was designed specifically to fix this problem. It acts like a literal bridge, connecting patients to the care they desperately need. And that's where something called non-emergency medical transportation, or NEMT for short, comes in.
So let's be super clear about what NEMT is. It's a special kind of transport service for folks who need help getting to a scheduled appointment, but they don't need a full-blown ambulance. Think about a cancer patient who is just too weak from chemo to drive an hour to their treatment, or a senior with mobility issues who can't get to their physical therapy appointment. For them, NEMT isn't just a convenience, it's a critical part of their treatment plan.
The difference here is really simple. An ambulance is for an urgent, life-threatening emergency. Its goal is immediate, life-saving help. NEMT, on the other hand, is all about consistency and prevention. It's about making sure people can get to their regular, ongoing appointments to help stop those emergencies from happening in the first place.
So, how do these services actually help people in a tangible way? It really all comes down to a few core pillars of support.
First, there's reliability. Just knowing for sure that you have a ride takes a huge weight off your shoulders. Second, these vehicles are built for safety and accessibility. They're equipped for things like wheelchairs and walkers. Third, and this is a big one, it opens up access to specialized care, like seeing a cardiologist or an oncologist who might be cities away. And finally, it gives people back their independence, and that is huge. It lets them manage their own health with dignity.
And, the impact of this goes way beyond just helping one person get to one appointment. When you give an entire community better access to care, it creates this incredible ripple effect that improves the health of everyone.
Think about it. When getting a ride isn't a barrier anymore, people can actually go to their regular checkups and screenings. They can stick to their treatment plans for chronic conditions like diabetes. They can get to their therapy appointments. It lets them stay connected with their doctors, shifting healthcare from being reactive to being proactive. It's a total game changer. And this quote, wow, it just gets right to the human side of all of this. So often, the stress of coordinating rides falls on family members who have to take time off work and juggle everything. NEMT lifts that logistical burden, and it lets families focus on what actually matters, being there for their loved one. So as we start to wrap this up, it's pretty clear that we need to think about this differently. This isn't just a taxi service. This is a truly essential, integrated piece of the entire healthcare system. So here's the main takeaway, the one thing to remember. You can have the best doctors and the best hospitals in the world, but they're useless if people can't get to them. Transportation isn't some extra perk. It is a fundamental part of healthcare. Period. And that really leaves us with one last question to chew on. We've seen how transportation can be this invisible wall blocking people from care. So what other hidden barriers are out there? Things like access to healthy food, or affordable childcare, or even just knowing how to navigate the digital world. What else is standing between people and their ability to live healthy, full lives? It's a really important question to ask as we try to build a better system for everyone.